My name is Arlene Cornejo, and I'm the Health Promotion Specialist over in Health Promotion Services at the Student Health Center. Right now, we're shifting away from using the term sexually transmitted disease, STD, because one, with disease, it means that there's some sort of symptom that's present. And a lot of STIs are asymptomatic, meaning that there are no symptoms present. And so sometimes when students don't see some sort of physical or outward symptom, they think that they don't have, they don't have chlamydia or gonorrhea, for example. And also just the term disease, when we ask students, well, when you hear the word disease, what comes to mind? They say things like long-term illness, hospitals, even death, and because of that, they may feel fearful or ashamed to go and get tested. So we're shifting away from using STD to STI, which is sexually transmitted infection. And with infections, there may be no visible symptoms, and that's really what we're stressing to students is someone can have an STI and not even know it because they don't show symptoms. The only way to know for sure if you or someone has an STI is have that conversation and get tested. In regards to a safer sex, what we always recommend for students, first of all, is making sure that they get consent. So that entails, first of all, knowing what the laws are. So if someone has been drinking, or if they're under the influence of any sort of drugs, medications, or if they're undergoing any sort of like psychological distress, then they legally lose the capacity to consent. So that's the first thing that we really stress with, for example, with Alcohol 101, which all students, incoming freshmen, are required to participate in. We let them know that you need to have consent, and this is what consent means. It's not about an absence of a no, it's about the presence of a yes with both parties, and at any point during sexual activity that yes can be withdrawn, and about respecting that change of mind. So that's the first step in having safer sex. From there, having discussions about sexually transmitted infections, last time they've been tested, or any sort of activities they may engage in. So having that conversation, we do provide STI testing over at the Student Health Center. Currently, we're working with different organizations on and off campus to provide free HIV testing over at the Student Health Center. They don't need to make an appointment. They would just need to come in between certain hours throughout the week in order to get that free HIV testing. So getting tested, having that conversation with their partner, and then from there, using anything from condoms if they're having sex with someone who has a penis, using a condom, knowing important step is knowing how to use a condom. So we provide that in university seminar classes. We'll do a presentation that will demonstrates the steps of putting on a condom correctly. Or if a student doesn't feel hasn't had that class or has more questions, they can either talk to one of our providers, or they can always come to Health Promotion Services, and we can have like a one-on-one meeting. If they're interested in, if they're engaging in sexual activity again with someone who has a penis, if they're interested in pregnancy prevention, then we can do counseling for different birth control options. Again, if they just have questions, they can come to Health Promotion Services. If they're interested in getting their prescription, getting a prescription, then they can always go to the Student Health Center. We provide, a wide array of different birth control options. We don't provide any IUDs, for example, or any ones that need to be inserted into the body, but we can provide referrals and help students find where they can go to get that done. So we would offer that. We also offer things like non-latex condoms for those with a latex allergy. We offer internal condoms to protect during anal sex, or it provides a greater protection during vaginal sex. So we would encourage the use of either a barrier method and or some sort of hormonal method to prevent pregnancy if that's a concern of the student, in order to engage in safer sex to reduce their risks of sexually transmitted infections.